Hi, everyone. This is Dr. Francisco, and this podcast is covering the orientation for the NCLEX prep. I want to first say congratulations for reaching this point, and for joining me on these final few weeks of support in your quest for NCLEX success. So I'm going to take you through the Blackboard course. It's not really a course per se in that you're not going to be meeting with me face to face. I don't have any scheduled lectures. There's no exams that I produce. There's some exams that you'll take in the programs that we're going to use. But for the most part, this is a self-paced review with deadlines and an accountability buddy, which is me. Someone just to keep you focused as you get closer and closer to that finish line and that NCLEX success. So if you found the podcast, you found your way to the Blackboard community. It's not really a Blackboard course, which is why you don't see it with your other courses, but you'll see it down in the community section. So it's built just like a traditional course in that there's announcements, and I do post a daily announcement. In my announcements, I have a NCLEX tip of the day. Oftentimes I post links to other resources that have to do with NCLEX success. I post daily or a daily NCLEX style question, and then the next day the answer and the rationale. So be sure that you're checking in every day, and taking advantage of those daily NCLEX tips and tools. You found the orientation podcast. The link is there. There is a course messaging. So if you wanted to message me right through the course, you can do that. You can also message me during the with the traditional IVCC email. The course information is found in the weekly folder. I'll click in that in just a second. I do also post a discussion forum. There's one for general questions, and then there's questions related to content. So perhaps maybe this was something that you have reviewed, and you're still not sure, or you might have a question about that. I can answer that here, and then everyone can benefit from that question. Certainly if it's a private question about performance or scores, you don't really want to do that in this public forum. That would be something that you would use the course messaging or through a private email. My contact information is here. Nothing is different other than, it's summer. My cell phone is there. I don't mind texting, but I don't like long text, asking about content. That I can answer better in an email or perhaps during that discussion forum. But if you're having technology issues or anything that I can immediately help you with, just be mindful of the time, 8 a.m. to 8 p.m. I'm available then. I'm up much earlier than 8 and I'm up later than 8. But again, I do want to have some me time and some private time. So just be kind of mindful of that time as well. If I don't answer immediately, it might be that might be working at the hospital, or I have my grandchildren, or any of those other duties that I have over the summer, and I will get back to you as soon as possible. Most of the time I can fire off a quick, I'll get back to you later type response, and then I'll respond later. I do have the links to Evolve because that is where we're going to spend the bulk of the time, and a link to Hearst. I'm not going to go into Hearst as far as showing you around. I think that you've had that with Mrs. Hodgson. Some of you have already been in there doing quizzes. I've kind of go in there and check. So a lot of you are still active in that Hearst link. We're going to be using that as well in the next 4 weeks. And then certainly following the Hearst review, you need to be active in that Hearst link. I also included the NCSBN website because here you can find the NCLEX test plan, although I do have it posted separately. You can find information about NCLEX testing in itself, a lot of great information there. There's some great videos, and I think I do link one into my daily announcement on how the NCLEX is scored. I know my 2211 students, the very last day, I showed them that, so it might be a repeat for some of you, but certainly worthy for review. Like, how do they score the NCLEX? How do they determine who passes and who doesn't? And it's a good little video, and that will pop up in one of the daily announcements. I do link the NCLEX test plan here. I think that's important as you finished your HUSI and you're looking at those categories. For example, basic care and comfort, what's included in basic care and comfort. You can go to the test plan and see that it's a lot more than providing oral care and making sure that their bed is changed and they're bathed. There's a lot more important nursing concepts in basic care and comfort. And so the test plan is a good tool for you to use when you're looking at your HESI results and you see a category that perhaps you scored, low in, and you're not really sure why you scored low or what is it that you didn't know to score low. Take a look at that NCLEX test plan and then how it's drilled down to the different topics. And that might help you in your focus of study. And again, I address that a little bit later in the class as well. So if I go into the weekly folder, the first one is open. So I did send out, well, maybe it's going to get there. Hang on. I did send out a draft of how the course is kind of laid out, and I did make some changes based on some things in Hearst and some HESI scores and so forth. So I did make some changes. So please make sure that you go by what is in the weekly folders. I don't give you the whole 4 weeks ahead of time because I don't want you rushing through that. That's not the intent of this. It is not a check, I did it, I got it done, I'm done. It is, what am I going to gain from this? And you gain what you put into it. And so that's the time and effort to complete these. So I will open up the folders on Sunday morning. Everything is due, on the due dates on the folder. This week is a little bit shorter because I want to try to get your weeks in a timely fashion so that you have time to focus on the Hearst and you still have some time to continue your preparation and then be able to get your NCLEX scheduled. So if I go into week 1, your assignments are that you're going to do this pre-test in NCLEX Review and Evolve. I'll show you where that's at. I don't want you to do it today, the 13th, when you have just completed your HESI exam. That you're tested out, but take it. In the next couple days. I know you have pinning on Saturday, so perhaps on Sunday, or maybe you're going to have time on Friday, whatever, to take this. Do your best. It's going to provide some rationales. It's going to provide some analysis to help determine your strengths and weaknesses. And you're going to summarize that and submit it to me. You don't have to submit your report, but as you look through that, kind of identify where your weak areas are and where your strong areas are, and kind of how you're going to approach your NCLEX preparation. This first week, you've got 2 modules. So there's basic care and comfort and safety and infection control. Again, both huge modules in NCLEX. Once you complete those modules, then you're going to take a 100-question exam. Now, I can see that you've accessed the modules and that you've kind of moved along through the modules. So don't just take the exam without looking at the modules, because that is the bulk of the review. As I said to some students when reviewing their HESI, is sometimes these uh, categories like basic care and comfort is not that you have to learn it, but as you're reading it, it's triggering memories of what you've learned maybe way back in your fundamental courses. And so that's part of what this review is to help you kind of pull that memory forward into a time when you're going to need it. And that is the NCLEX, when you're going to need that information. So those 2 modules, and then there's 3 very quick quizzes in Hearst that you're going to design yourself based on your HESI results. So if you're unfamiliar how to do that in Hearst, reach out to me, but my assumption is that most of you are enrolled in Hearst and understand how to make those quizzes for you. There's also a submission for submitting that pre-test summary. Again, much like a email where you're going to form an attachment and then go ahead and submit that to me. Deadline for this is Tuesday at 10 o'clock. Again, it's a little bit shorter deadline because I wanted to keep us somewhat on track to be done that week right after the Hearst. So What else in here? Again, the next weekly folder will open then on the following Sunday at 7 a.m. And then that due date will be there as well. So again, it's doable. It's not difficult, but it is going to take a little bit of time and a little bit of focus. You don't want to rush through this. And I'm going to show you this Evolve product. Let me just get in there and share it. So hang on just a second. I'm in it already. So the course that you need to be is the Fall 2019. This is a product that you purchased when you first started the program. If you are a returning student who do not have current access to this, you need to reach out to me, and you need to reach out to me pretty quickly because I need to know how many access codes I need. I'm able to get some free access codes from Evolve that are going to give you, I believe, either 4 or 6 week access to this course. They don't give you the whole course for 48 more months, but they'll give you enough to get you through to the NCLEX. So when you come in here later this afternoon, I'm going to be kind of organizing what we're doing into folders. So you'll see some folders. Actually, I'm going to go in and view as a student, so hang tight here. There we go. So if I go into the course, I'm going to see 3 general categories in this course. There's client needs, there's content area, and there's concepts. And most of what we're going to do is in the client needs. I'll show you what the other ones entail as well. So if we go in the client needs, you're going to see the pretest. 1, 2, 3, 4. Was it 1, 2, 3, fourth down? There's your pretest. There's a lot of other information here. The course orientation has to do with if you're taking this whole product as a course. Again, that's not my intent in 4 weeks. Here's the test taking tutorial. If you have not completed a test taking strategy tutorial, I strongly encourage you to do this. If you click in here, it's going to open up. Hopefully it's going to open up. There we go. And if I click under introduction, these are all the different test taking strategies. I know it can look very overwhelming, but most of these are a slide or 2. And so you can kind of work through these different strategies. You know, you're going to approach the NCLEX a little bit differently than you approach your unit exams, because when you take a unit exam, you know exactly what you're being tested on. When you take the NCLEX, you have no idea what the content is that you're going to be tested on, other than it's open season for anything that is considered entry-level practice for nurses. So sometimes these test-taking strategies will be helpful to kind of use those skills to be able to answer the question, particularly that question where you have no idea what they're talking about, okay? Because there will be questions like that. Again, very intuitive. There's embedded. So if you see something in blue with a hyperlink line, you know, click on that. You can open it up. For example, if there's looking for strategic words, there's a list of words that you would identify in a test question that would be influencing your answer. And these are things like priority, next. Actually, let me click in there and see if it'll pop up for me. Early, late, best, first, initial, immediately, most likely, least likely. Again, you occasionally will see this, but we focus on what we want the nurse to do. So when it says least appropriate, we're kind of focusing on what we don't want the nurse to do. And so sometimes you won't see that least appropriate in those questions. So that's the test taking tutorial. And again, I strongly encourage you to do that. It's not required, but you know, certainly I'll see who has completed it. It's something that I tell students all through the program, if they're struggling with exams, that, you know, sometimes it's not that the content isn't there, but they're having a difficult time applying that content through testing, maybe having I don't want to say poor test taking skills, but perhaps underdeveloped test taking skills. Once you complete that pre-test, again, you should be able to have a study calendar generated. And I'm going to click in here just to show you. And what you do is you kind of input your test scores on some of the most important category. So I'm just going to put some, you know, um, general scores in here. And what this does, so this is a 12-week study plan. So what it does is it tells me to take the pre-test, then it's taking me to Module 7, which is one that we're going to do. Module 7 over 2 days, take the exam. Here's do another module, rest and relax on your day 6 and 7. That might be your weekend, might be during the week. So it's going to take you through this whole program based on your strengths and weaknesses. So it identifies maybe what your you might start out with an area that's a weakness, then you might go to a strength, then you might go to a weakness. It just depends, and it's individual to you and what you input as far as these scores. So you'll see that you will go through all the modules, and then there are some I call them like capstone exams, or exams that you should be taking a little bit closer to your NCLEX, and I'll show you those in just a second. So that's a good good tool in that study calendar. So when you get into the modules, you'll see the modules here, and the first one we're doing is basic care and comfort. And you'll see that there's 3 lessons in basic care and comfort. You got basic needs, mobility, immobility, assistive devices, and non-pharmacological interventions for pain. So these are covering everything that falls under that umbrella of basic care and comfort. So when you click in these, again, there's little modules. You'll see, again, this could be intimidating, but again, they're just like one slides. And so when you go in here, and here is urinary elimination. So here's a quick, down and dirty format for a review of what would you assess, or who would you assess to identify issues with the urinary system, and then you kind of work through it. So this particular lesson is 44 slides. And so you would just kind of work through these different modules, and then when you've completed them, then you take the 100 question exam, which you would find at the end of the last module. Okay. So I think we're doing basic care and comfort, safety and infection control, pharmacology, and intravenous therapies. I heard from a lot of students following the HESI that they felt like they had a lot of pharmacology, and that might have been a weak area. So I do include that. Monitoring for health problems. This is a big category as well. And I think I have physiological health problems. I know there's 2. I can't remember, 2, and then the Hearst, and then 2. So you're going to get through 6 of the 10 modules in these 4 weeks. What's not assigned, but I encourage you to also complete, there's crossing the finish line practice exams. So there's an OB, adult health, mental health, and pediatrics, and then delegation prioritization, and then disaster management. So they're individual exams that cover that content. Test yourself quizzes. Let me see. There's just a couple different quizzes there. Live review videos. So there's some videos that cover certain content. Again, there's some, if they're not sure about preeclampsia, there's a little video that will cover that information. So you're seeing here, there's quite a bit of topics here. And then this comprehensive exam, I kind of alluded to this in the little NCLEX prep guide that I sent out to everybody. This is that very long exam. It's 265 questions, which used to be the maximum questions on NCLEX. Since COVID, they've kind of shortened the maximum questions so that they can get students in and out in a shorter time frame in those testing centers. So I believe it's 160, 165 is your max. I do suggest trying to take this exam in one sitting to emulate the NCLEX. You don't want to take 50 today and 50, in 2 days, because that's not the intent. The intent is to also train you physically to take that long exam. feedback I heard as well from the HESI is, I've never taken an exam that long. I couldn't sit that long. My brain couldn't stay focused that long. And for that chance that you could get all NCLEX questions, you want to be prepared both physically and emotionally and cognitively to be able to take that long exam. So everything you're going to do is going to be in this patient needs category. Now, if you want to review content specific, perhaps you were weak in mental health. You could go in and take the mental health module. Again, some of it is a repeat of what you might find in that basic needs, but if you want to focus just on mental health, you can come here. If OB was a weak area, maybe you want to review some critical care because that's not a huge focus in our clinicals is critical care. You could take that module as well. And then this fundamental skills, I think excuse me, now I'm getting the hiccups, is another great module as well. A lot of it is going to cover some of the information that you already had, but some of it is it's broken down a little bit differently. So med administration and calculations. So you might know how to figure up the dose, but you're forgetting what are the basic principles of med administration. You could find that here. Nutrition, vital signs, and diagnostic tests. Again, the different categories, sometimes this can be repetitive and redundant, but sometimes that's how we learn is through repetition. And then the last section is, hang on, let me close this up, is concepts. So schools that use concept-based curriculum, this is really where they would go. So if we went into the HESI concepts, which is also broken down on your HESI exam, here's the biophysical. So again, it's broken down very much like your HESI results. So you could always go in here as well and do review. Again, I don't include it in part of the course because this would be very individualized for you as to what you're going to focus on. So you do have that resource as well. I almost wanted to say, is there any questions? But I know that there's nobody out there to talk back to me immediately. I'm in Zoom, but I'm not in a Zoom class where I can be interactive. But certainly if you have questions, reach out to me via email. I'm here to be, that person that's going to help cheer you on and guide you and hold you accountable. So I do ask that you do take a serious approach to this, that you do complete this. Give us 4 more weeks of your time and your focus, because this is meant to help you. It's not a punishment. It is not a, gosh, they thought I did really bad in the program. It's to help you become successful on the NCLEX and to be able to successfully enter nursing practice, because goodness, we know we need you. So we need you to get there. So, and to get there, only thing stopping you is the NCLEX. So we need to get you to that point where you can be successful in the NCLEX. So that is it for the orientation piece. If you have any questions, again, please reach out to me via email. And I look forward to working with you and getting you to that finish line. Take care.